Risk factors are circumstances that can increase the risk of getting atrial fibrillation or worsen your condition. The most important risk factors that you have some control over are excess weight, too little physical activity, hypertension, excessive alcohol consumption, obstructive sleep apnea. Excess weight. Every point of BMI above 27 gives you an 8% increased risk of developing atrial fibrillation. If you are overweight and have atrial fibrillation, weight loss will decrease your atrial fibrillation symptoms, give you better results from treatment, both medical and with ablation, provide a higher quality of life despite atrial fibrillation. Too little physical activity. 30 minutes of moderate physical activity daily will decrease your atrial fibrillation symptoms, enhance the effect of weight loss. Hypertension. If you have high blood pressure, the risk of getting atrial fibrillation is increased by 4 to 5 times. High blood pressure also increases the risk of having a blood clot or bleeding in the brain. Treating high blood pressure reduces the strain on your heart and circulation and reduces the risk of getting a blood clot or bleeding in the brain. Alcohol. More than 4 to 7 units per week increases the risk of developing atrial fibrillation. More than 2 to 3 units at once increases the risk of developing atrial fibrillation. Obstructive sleep apnea. It is important to confirm whether or not you have obstructive sleep apnea. Often, your spouse is the best person to ask. Treatment can reduce the occurrence of atrial fibrillation and increase the effective treatment for atrial fibrillation, both medically and with ablation.